I'm Dr. Jeff Schels with Advanced Chiropractic, and today we're going to go over exactly how to use the Denneroll home traction device. So if you're watching this video, it's because it was recommended that you use this at home to help get more of a curve in the neck area. So we're going to go over how to use it, we're going to go over exactly what it does, and then we're going to demonstrate its usage so that you know exactly what you need to do to get the very best results. So the way the Denneroll works is you lay on it with the shoulders facing this direction, just like this, and you just drop your head back so that your head is dropped back over the Denneroll. And the key is your head really has to be dropped back so that it's not touching the floor. If you use the Denneroll and your head actually touches the floor, you'll need to put a little book or something to raise the Denneroll up so that your head actually just drops back. And the other thing is, when you use the Denneroll, you always want to use it either on a yoga mat or on a carpet. You know, on a bed, it sinks into the bed and you really don't get much traction, or a hardwood floor is a little bit too hard for that. The other thing is, you know, with the Denneroll, there are people that when they lay on their backs, that they have low back pain. So it is okay with this Denneroll to actually bend your knees up to take a little bit of that pressure off the low back when you use it. So the way that it works is this: you lay down with the Denneroll just like this, and you just drop your head over it. And what happens is, if you want to take your neck from where there's a reduced curve to where there's more of a curve in there, there's this ligament that runs along the front of the neck called the anterior longitudinal ligament, and it has to go from this to actually lengthened. It has to get longer. And so the way that it works is, once you lay down, it takes that ligament and it puts tension on the ligament. Now, for the first 10 minutes, the ligament doesn't actually lengthen, okay? It just has tension. After 10 minutes, the ligament starts to lengthen, and it will lengthen for 10 minutes. So the first 10 minutes you lay on it, there's really no structural changes taking place, and it's really the next 10 minutes where you actually get a change in the shape of the spine. So the key is, even though you always start it just at 3 minutes, and then the next day you do 4 minutes, and the next day 5, and you add 1 minute a day when you first start, the key is you really do need to get up to 20 minutes, okay? Now, we recommend at least 5 days a week. Now, a person can do it more than that, but there's no benefit in doing it any longer than 20 minutes at any one time. But 5 days a week is the key, that over a period of time to actually lengthen that ligament and get more of a curve in the neck through there, all right? So now it depends on your specific condition as to when you will start using the Denneroll. You know, there are patients that use it right from day one, but there are others that have to wait about a month or so to use it. So your doctor will let you know when you should start the Denneroll. And then next, we're gonna actually demonstrate how to use it. Now, you're gonna be doing the Denneroll in the lower part of your neck. So where that is, if you were to wear a necklace, the necklace would fall right along a line right here. And so where the necklace would go, there's usually one vertebra where the back of the vertebra is a little bigger, so there's a little bump. So you're going to do the Denneroll where this little lift is either right on that bump or just a tiny bit above the bump, just like this, with this part here facing down. So you'll come right up, and again, you're lying on either a yoga mat or the carpet, and you're going to place the Denneroll so it's right at that bump, and then your head just drops way back. And so just like that. So you want your head to be dropped back so that you're getting that stretch in that ligament. Now, if you have back pain when you do this, lower back pain, you can certainly bend your knees up, and that'll usually take a little bit of pressure off the knees. And again, you just start at 3 minutes, and you add 1 minute a day until you get to 20 minutes. So the key is you got to get to 20 minutes at least 5 days a week doing this. Now, as you do it, it's not uncommon to have some discomfort as you're actually changing the shape of your spine over time. However, if you ever are doing it and you have any sharp pain, or it just becomes too uncomfortable, then of course discontinue. However, talk to your doctor so we can make sure that we can figure out what's going on and get you back on.